All right, let's talk about something that's incredibly common, but actually surprisingly complex: wrist injuries. I mean, from a simple trip and fall to a big sports injury, the wrist is so often our first line of defense, and boy, does it take a beating. So let's dive right in and really look at what happens when things go wrong. I mean, who hasn't done this, right? It's pure instinct. You start to fall, and what's the first thing you do? You throw your hands out to catch yourself. It's such a universal experience, and it's pretty much the number one reason people end up with the exact injuries we're about to get into. That one simple action can kick off a whole bunch of different fractures and strains. So, to make sense of all this, we're going on a quick tour of the wrist. Think of it as a roadmap. We'll kick things off with the classic breaks, then check out some fractures with some pretty famous names. After that, we'll see what happens when the tendons and nerves get involved, and we'll wrap things up with the all-important thumb. Okay, first up, the absolute classics, the heavy hitters of the wrist fracture world. When someone tells you they broke their wrist, there's a very, very good chance they're talking about one of these two injuries to the distal radius, which is the bigger of the two bones in your forearm. Now, this is where it gets interesting, because these two fractures are really just two sides of the same coin. The Colles fracture is by far the most common. That's where the broken piece of bone gets pushed outwards, or dorsally. Just remember the little phrase on the slide: Collie dogs like it outside. Simple, right? The Smith fracture is literally the exact opposite, a reverse Colles, where that same bone fragment angles inward towards your palm. You know, medicine has some truly great names for things, and the dinner fork deformity has to be one of the best. It's so descriptive, and it perfectly illustrates what's going on with a Colles fracture. Because that broken piece of the radius gets pushed up and back, it creates this very specific bump that makes the whole wrist and hand look just like a dinner fork lying face down on a table. And here's a really important clinical tip. You see, the Colles fracture is sometimes called an old lady fracture because it's so closely linked to osteoporosis. But if an older man gets one from just a simple fall, that is a huge red flag. It's a big sign that his bones are weaker than they should be, and that should immediately trigger a workup for osteoporosis, starting with a DEXA scan. Okay, so we've talked about the fractures that happen near the joint. Now let's take it a step further. We're moving into fractures that actually go into the joint surface itself. These are called intra-articular fractures, and believe me, they bring a whole new set of problems to the table. So here we have two more of those famous named fractures. First, the Barton fracture. This is a break right on the rim of the radius, and the big deal here is that it often causes the entire group of small wrist bones to dislocate. Then you have the Hutchinson, or chauffeur's fracture. That's a break of the radial styloid. You know, that pointy bit of bone you can feel on the thumb side of your wrist. But the real danger with this one is that it's often tied to a scapholunate dissociation. That's a fancy way of saying a super important ligament between two of the small wrist bones has torn. So far, we've been all about the bones, but a wrist injury is almost never just about the bones. You have all these tendons. Think of them like tough, fibrous ropes connecting muscle to bone, and they often get caught in the crossfire. Let's look at what happens when they get inflamed, a condition we call tenosynovitis. This is a really nice breakdown of what's behind tenosynovitis. It can be from some pretty strange infections like TB, or it can even be one of the first signs of an autoimmune disease like rheumatoid arthritis. And if you get a puncture wound that gets infected, that is a true surgical emergency. But honestly, the most common cause of all, good old-fashioned overuse. And the absolute classic example of an overuse injury is de Quervain's. You gotta love the nicknames Mommy Thumb or Washerwoman Sprain. They tell the whole story, don't they? It's famous for showing up in new moms because of that repetitive motion of lifting and holding a baby over and over again. It specifically hits the tendons that pull your thumb outwards. All right, next stop on our tour, we're diving even deeper into the wrist to talk about nerves. There's a really, really tight space in the wrist that a ton of important stuff has to squeeze through. And when that space gets just a little too crowded, that's when you get big trouble. You know, this is a great way to think about the carpal tunnel by focusing on what's not in it. It's kind of like a classic trick question from medical school. As you can see, there are some major tendons that you might be surprised to learn travel completely outside of this famous little tunnel. So if all that stuff isn't in there, what is? Well, it is packed. There are 10 structures crammed in there, 9 tendons that let you curl your fingers and thumb, and one very, very important median nerve. And it's that nerve that causes all the problems when it runs out of room. And that's the whole story, right there. Carpal tunnel syndrome is simply what happens when that median nerve gets squished. And yeah, we all think of it as an injury from typing all day, but it's also linked to other things like pregnancy, kidney dialysis, or an underactive thyroid. Basically anything that can cause swelling in that tiny, confined space. For our final stop, we have to focus on the thumb. I mean, the thumb is a total game changer. It's responsible for so much of what our hands can do. But because of its unique spot and how much it moves, it's also susceptible to some very specific and pretty serious injuries. This one gets its names from the classic ways it happens. The old school name, Gamekeeper's thumb, came from gamekeepers breaking the necks of small animals. A bit grim, I know. Today, it's more often called skier's thumb, from skiers falling and having their thumb bent back by their ski pole. Either way, the injury is a tear of the ulnar collateral ligament, the UCL, which sits on the inside of the thumb's main joint. Now, you might be thinking, okay, so it's a torn ligament, that's not great, but what's the really big deal? Well, with this specific ligament, there's a sneaky complication, a hidden trap that can turn what seems like a simple sprain into a problem that absolutely needs surgery. And that hidden villain has a name, the Stener lesion. This is the one thing that doctors are most worried about when they even suspect a gamekeeper's term, and it's something you just cannot afford to miss. So how does this even happen? Well, first, the ligament has to tear completely, but then the torn end flips back and gets caught on top of another nearby structure. Once it's trapped up there, it can never, ever get back to where it's supposed to be to heal. Think of it like a rope that's been thrown over the wrong side of a fence. There's no way for it to fix itself. At that point, surgery is the only way. And this brings us to one of the most critical, absolutely essential takeaways of this entire explainer. You might be tempted to pull on the thumb to see just how unstable it is and get an x-ray, right? That is a huge mistake. Performing a stress view like that could actually cause a Stener lesion by forcing that torn ligament into the wrong spot. So the next step is never a stress x-ray, it's an MRI or an ultrasound. So we've seen how broken bones, torn ligaments, and pinched nerves all weave together this complex web of injuries. It really just shows you what an intricate masterpiece the wrist is. But our whole journey today, everything we've talked about, has been built on the wrist's foundation, those 8 small carpal bones. Which leaves us with one last massive question. What happens when that foundation itself,